Every single day, millions of active, health conscious seniors are swallowing a tiny pill before bed that is quietly, progressively paralyzing their bladder. They buy it over the counter at their local pharmacy, thinking it is a safe, doctor approved way to get a good night's sleep so they can enjoy 18 holes of golf the next morning. Instead, this one common pill is the hidden culprit behind those sudden, desperate rushes to the bathroom, that frustratingly weak stream, and the exhausting routine of waking up 3 or 4 times a night. If you have been struggling with your bladder and assuming it is just an inevitable tax you have to pay for getting older, you might be entirely wrong. The real enemy might be sitting right inside your medicine cabinet, disguised as a harmless, everyday remedy. I am Dr. Carl, and I have spent 16 years in private practice, specializing in urology, helping thousands of men and women regain control of their bladders so they can live their retirement years on their own terms. Today, we are going down the pharmacy aisle to expose the 5 most common medications and daily chemical habits that are absolutely wrecking your bladder health after 60. We will talk about why some of the most popular pills for blood pressure, allergies, and joint pain are secretly making your bladder work twice as hard, and I will show you how to identify them. But I want you to pay extra close attention to number 4 on our list, because it is a medication specifically prescribed by doctors to treat bladder issues, yet in many seniors, it actually makes the problem dramatically worse while introducing a side effect that is far more dangerous. By the time we finish today, you will have a clear, step-by-step checklist to take to your next doctor's visit so you can finally stop managing symptoms and start fixing the root cause. Before we dive into the first medication, I want to ask you a quick question. Drop a comment below and let me know, how many times are you currently getting out of bed to use the restroom each night, and what city or state are you watching from? I read every single comment personally, and your real-life experiences directly shape the topics I cover in these videos to make sure I am giving you the practical help you actually need. Now, let us start with the single biggest offender I see in my clinic week after week. It is the over-the-counter sleep aid, or the PM version of your favorite pain reliever. You know the ones. They usually have PM written in bold letters on a blue box, or they are marketed as simple, non-habit-forming nighttime sleep caps. The active ingredient in almost all of these nighttime formulas is a drug called diphenhydramine. While it does a wonderful job of making you drowsy, it belongs to a class of drugs called anticholinergics. To understand what this does to your body, imagine your bladder is a muscular balloon. To empty properly, 2 things have to happen at the exact same time. The muscular wall of the bladder has to squeeze, and the little valve at the bottom, your sphincter, has to relax. Anticholinergics work by blocking the chemical signals that tell your bladder muscle to squeeze. When you take these pills, your bladder muscle essentially goes to sleep along with the rest of your brain. It loses its tone and its ability to contract. So, when you get up in the middle of the night to use the restroom, your bladder cannot squeeze hard enough to push the urine out. You sit there waiting, your stream is weak, and you end up leaving half the urine behind. Because your bladder never truly empties, it fills back up to capacity in just an hour or two, sending you right back to the bathroom. Research from the American Urological Association has repeatedly warned that anticholinergic medications can cause severe urinary retention in older adults, sometimes leading to emergency room visits because the bladder becomes completely blocked. If you are taking a nightly PM pain reliever or an over-the-counter allergy pill just to sleep, your first step this week is to check the back of the bottle for diphenhydramine. Talk to your doctor about safer, non-medication sleep habits or alternative options that do not paralyze your bladder muscles. Next up is another category of medication that seniors frequently take during cold and flu season or to deal with chronic sinus congestion, over-the-counter decongestants. These are the pills you often have to ask the pharmacist for behind the counter, usually containing pseudoephedrine. Many seniors take these because they want to stay active, go on their morning walks, and keep their sinuses clear. But if you have bladder issues, these decongestants are like pouring gasoline on a fire. To understand why, we have to look at how these drugs work on your blood vessels and your bladder neck. Decongestants are designed to shrink the swollen blood vessels in your nose, which they do by stimulating certain receptors called alpha adrenergic receptors. The problem is, your bladder neck and your prostate, if you are a man, are absolutely packed with these exact same alpha receptors. When you swallow a decongestant, it does not just squeeze the blood vessels in your nose, it clamps down hard on the exit valve of your bladder. It is like putting a tight, kinking pinch on a garden hose. If you already have a slightly enlarged prostate or a weak bladder muscle, this sudden clamping makes it incredibly difficult to start your stream. You have to strain, press on your stomach, and wait. A study published in the Journal of Urology highlighted that decongestants are one of the leading drug-related causes of acute urinary retention in older men. If you are struggling with sinus pressure this week, try swapping out those oral decongestants for a simple, drug-free saline nasal spray or a warm steam inhaler. Of course, always run any changes by your physician, especially if you are managing high blood pressure, as these medications can affect your heart rate too. Our third offender is a major surprise to many of my patients because it is a medication class they take to protect their cardiovascular system: calcium channel blockers. These are very common prescription medications used to treat high blood pressure and chest pain. If you look at your prescription bottles, you might see names ending in dipine, like amlodipine or nifedipine. They are fantastic drugs for keeping your blood pressure in a safe zone, but they can have a frustrating side effect on your lower urinary tract. These medications work by relaxing the smooth muscle cells in the walls of your blood vessels, which allows the vessels to widen and lowers your blood pressure. However, your bladder is also made of smooth muscle. Calcium channel blockers do not know the difference between a blood vessel muscle and a bladder muscle, so they relax the bladder muscle too. When your bladder muscle is overly relaxed, it cannot generate the force needed to empty fully. This leads to a sluggish bladder, leaving residual urine behind after every trip to the bathroom, which creates constant urgency and raises your risk of urinary tract infections. A comprehensive review by the Mayo Clinic notes that calcium channel blockers can significantly contribute to urinary retention and overflow incontinence in seniors. If you are taking one of these medications and have noticed your bladder symptoms worsening since you started it, do not just stop taking your blood pressure pill. That can be highly dangerous. Instead, schedule a conversation with your doctor at your next physical and ask if there is an alternative class of blood pressure medication, like an ACE inhibitor or an ARB, that might be friendlier to your bladder. This brings us to number 4, the absolute paradox of the urology world, and the one I urged you to watch out for. These are prescription anticholinergic bladder medications, like oxybutynin or tolterodine, which are commonly prescribed to treat an overactive bladder. If you went to your doctor complaining that you have to run to the bathroom every 30 minutes, there is a very high chance you were handed a prescription for one of these pills. The idea is that by blocking those muscle contractions, the drug will calm your twitchy bladder down so you do not feel that sudden frantic urge to go. But here's the catch. In many seniors, especially as we get older, these drugs work a little too well. They do not just calm the bladder, they completely stall it. You might find that while you are not running to the bathroom quite as urgently, you suddenly cannot empty your bladder at all, or you start experiencing trickle leaking because your bladder is so full it is literally spilling over. Even worse, the medical community has become deeply concerned about the long-term cognitive effects of these specific drugs. Because they block acetylcholine, a vital neurotransmitter for memory and brain function, numerous long-term studies, including research published in the Journal of the American Geriatric Society, have linked the chronic use of these traditional bladder pills to an increased risk of cognitive decline and dementia in seniors. Let us take a quick pause here. If this information is helping you connect the dots about your own health, please take a second to tap that like button. It tells the algorithm to show this video to more seniors who might be struggling in silence, thinking their bladder issues are just a normal part of aging. And tell me in the comments, has your doctor ever discussed these memory risks with you when prescribing a bladder medication? I really want to know. If you are currently taking a medication like oxybutynin, please do not panic and throw it in the trash tonight. Stopping it suddenly can cause your symptoms to rebound aggressively. Instead, make an appointment with your urologist or primary care doctor. Ask them about newer, modern alternatives like beta-3 agonists, which work on an entirely different pathway to calm the bladder without blocking acetylcholine, protecting both your bladder function and your brain health. Our fifth item is a habit that many health conscious seniors adopt to manage their weight or control their blood sugar: consuming artificial sweeteners. You might think you are doing your body a massive favor by choosing diet sodas, sugar-free iced teas, or adding those little yellow, blue, or pink packets to your morning coffee. You are avoiding sugar, which is great for your waistline and your glucose levels, but your bladder is paying a heavy price. Artificial sweeteners like aspartame, sucralose, and saccharin are highly acidic and highly irritating to the delicate, sensitive lining of your bladder. Think of your bladder lining like the skin on your arm. If you have a mild scrape and you pour water on it, it feels fine. But if you pour lemon juice or vinegar on it, it stings intensely. When your kidneys filter these artificial sweeteners out of your blood, they concentrate them in your urine. This highly irritating urine sits in your bladder, chemically nagging the bladder wall, which triggers sudden, intense spasms. Your brain interprets these spasms as an emergency signal that you need to find a restroom immediately, even if your bladder only has an ounce or two of fluid in it. Many clinical trials have shown that eliminating artificial sweeteners can dramatically reduce bladder urgency and frequency within just a few days. My challenge for you this week is to go completely sweetener-free for 7 days. Swap out the diet drinks for plain water, perhaps infused with a slice of cucumber or a sprig of mint, and see if those sudden, frantic trips to the bathroom begin to quiet down. When Arthur came into my office, we did a thorough review of his medications. It turned out he was taking an over-the-counter PM pain reliever every single night to help with his stiff shoulder so he could sleep, and he was taking a prescription decongestant daily for his desert allergies. He was essentially double-dosing his bladder with medications that paralyzed the muscle and clamped the exit valve shut. We worked closely with his primary care physician to safely phase out those two medications. We replaced his nighttime sleep aid with a gentle, non-medication bedtime routine and swapped his oral decongestant for a simple steroid nasal spray. Within just 3 weeks, Arthur's nighttime restroom trips dropped from 4 times a night to just once. His stream got significantly stronger. He got his confidence back, and just last month he sent me a postcard from a road trip through Utah. He did not have to plan his route around rest stops once. If you want to start seeing improvements in your bladder health like Arthur did, here is your concrete 5-step plan for tonight. First, gather all your medications, both prescription and over-the-counter, and place them on your kitchen counter. Second, look closely at the labels of any sleep aids, allergy medications, or pain relievers, and check for the ingredient diphenhydramine. Third, make a dedicated list of any medications you are taking for blood pressure, chronic pain, or bladder control, and write down when your bladder symptoms first started to see if there is a timeline connection. Fourth, replace all artificial sweeteners in your diet with plain, clean water for the next 7 days to give your bladder lining a well-deserved break. And fifth, call your doctor's office tomorrow morning and schedule a brief medication review to discuss safer alternatives for any bladder-unfriendly drugs you identified on your counter. Taking control of your bladder health after 60 does not have to be a mystery, and you do not have to just accept these symptoms as a normal part of getting older. Sometimes, the best medicine is simply understanding how your daily habits and medications are interacting with your body. In our next video, we are going to look at a highly common, popular health drink that many seniors consume daily for their digestion, but which actually acts as a hidden bladder irritant that triggers sudden urge leaks. You will be very surprised to see what it is. I am Dr. Carl. Stay well, and I will see you there.